Breaking a bone can stop us all in our tracks, no matter what age we are in. But particularly for children, a fracture can come with a lot of fear and, worst of all, the feeling of helplessness. Of interest in this week's piece is fracture of the elbow in children, which may lead to gunstock deformity, borrowing its name from the way it is shaped.
This is a deformity whereby when the child puts out the arm to stretch it out, it looks like they're holding a gun. So when the child tries to reach out for something, it seems like the arm is reaching out like almost to the other side, it's deviating this way.
With 9 million osteoporotic fractures occurring every year worldwide, frequent falls in small children while playing has added to the increase in incidence of gunstock deformity.
And that becomes a very deforming thing. You know, the parents are distressed about it, the child is distressed about it because it looks very unpleasant to the side. And also, it limits them. When they want to reach out, they can't really reach out far.
We pop in during one of the many corrective surgeries Dr. James Kinywa, together with his team, conduct at the Kijabe Mission Hospital.
And if you need to get lost to follow up, you're very sure that his station is going to go.
Today, he's doing a reconstructive surgery on a 9-year-old boy who has had this deformity for the past 4 years, an operation which takes close to 3 hours.
And another one here that they will put to be able to make some fixation, but also remove a wedge of bone.
Fractures in this region need aggressive treatment and proper rehabilitation protocol to gain better functional outcome.
After 2 weeks, usually, we take out the dressing, take out the plaster, and we allow them to start moving their arm and their elbow as they will. And it's amazing, by the way, if you see these kids like 6 months later, even if you did an x-ray, you won't tell the difference between this arm and this arm.
Though manageable, recovery patterns for this deformity in children and adults are quite different.
The problem in adults is that they have to have post-op after you do the surgery. The same thing actually. You have to send them to physiotherapy for them to aggressively start moving their elbow. Others, they get really, really stiff. But in children, they don't get stiff at all.
More importantly, when anyone gets a fracture, it is of essence to treat and manage it at that point so as to prevent it from developing into the deformity.
Whether you have a wound or not, it's important for us to try and immobilize. So like if it's in the upper extremity, a simple arm sling, you can just take a lasso and tie an arm sling around the elbow just to immobilize the arm for comfort, and that reduces pain, and then quickly take to hospital.
Bones are hard and tough. They're really not that easy to break, but they do break. Proper treatment and management in the eventuality of a fracture is the only sure way to avoid deformities such as the gunstock. Ouma Onyango, reporting for Talk Health on KUTV, Nairobi.